Hi, I'm Dr. Jennifer Sumner, and I'm a neuropsychologist at Kaizen Brain Center. At Kaizen, our goal is to help individuals with emotional, cognitive, and behavioral problems. Many of these problems stem from traumatic brain injury or other insult to the brain. Because June is PTSD Awareness Month, we want to help spread awareness to not only our patients, but to family and loved ones who know someone that has PTSD and PTSD that's associated with traumatic brain injury. We know from the literature that TBI and PTSD often go hand in hand. They share several symptoms and both stem from exposure to a traumatic event. With PTSD, this traumatic event could be a motor vehicle accident, it could be combat exposure in war, physical or sexual assault, or maybe even exposure to a natural disaster. With traumatic brain injury, the trauma is from some insult or blow to the head, resulting in some type of altered consciousness. Now, both of these injuries have symptoms of depression, anxiety, they may have loss of memory, problems with attention or concentration, definitely some sleep problems, fatigue issues. Symptoms for both of these disorders happen for different reasons. With post-traumatic stress disorder, someone's been exposed to a trauma and they may feel that their life or the life of a loved one is threatened. And consequently, they may re-experience this event over and over again, maybe through nightmares or flashbacks. And they may try to avoid triggers that remind them of these situations. So talking to people about the incident or areas or locations that remind them of the traumatic event may be things that they avoid. In addition to re-experiencing the trauma and avoiding trauma triggers, someone may have negative thoughts that occur following the trauma, whether they blame themselves or feelings of depression, or whether they associate negative consequences to themselves. Most people don't know that individuals with PTSD might also experience cognitive problems like memory loss, attention or concentration difficulties, issues with depression and anxiety. People with traumatic brain injury are at increased risk for experiencing post-traumatic stress disorder. We're not sure why that occurs yet. There are lots of theories out there, but we do know that TBI and PTSD can often compound the symptoms someone feels. It may heighten the depression, it may increase the sleep disorder, and it may create more irritability or reactivity. Our goal is to help educate people on what the symptoms of TBI look like, what the symptoms of PTSD look like, and how to treat them. There are things that can be done for both. Often cognitive behavioral therapy may be combined with some type of medication like a selective serotonin reuptake inhibitor or an SSRI may be beneficial. People with PTSD seem to show the most improvement by participating in exposure therapy or cognitive processing therapy, and this is beneficial for people with TBI too. There's no reason why someone with a TBI couldn't receive the same treatment as any individual without a TBI for their symptoms of PTSD. So there is hope out there, and there are things that you can do for the disorder.